And this crash is the second one involving a child or a teenager in less than a week here in Southwest Florida. A newly released Tampa Bay Times investigation reveals the majority of Florida hospitals do not have the necessary doctors or equipment to treat critical cases involving children. 4 in Your Corner Sarah Belsol breaks down the facts and has more on if our local hospitals are prepared to treat your child.
A 5-year-old struck crossing the street in Naples. A 17-year-old Port Charlotte teen hit walking to his bus stop. Both crashes just days apart and both victims in need of immediate critical care. But who should treat pediatric trauma cases? Well, according to a Tampa Bay Times investigation, pediatric trauma centers. The investigation says even though other hospitals may be closer in distance, they may not have the doctors or the equipment to best treat a child. The child could also ultimately be transferred to another hospital, which could waste valuable time. The report says it's more common now than ever before for children to be taken to an adult trauma center, especially in areas where the closest pediatric trauma center is more than 50 miles away, the Tampa Bay Times using Lee Memorial as an example. But while 5-year-old Deshaun Prejudice was airlifted to Tampa General Hospital after he was struck crossing Davis Boulevard Sunday, 17-year-old Angel Garcia is being treated at Lee Memorial after he was hit in Port Charlotte Thursday. Fox 4 reached out to Lee Memorial Hospital, wanting to know if it's prepared to handle these critical pediatric cases. In a statement, a spokeswoman says they are, and that treating children is not a one-size-fits-all solution. She says, quote, delivering the best care sometimes means getting the patient to the closest hospital or trauma center to be stabilized before transfer to a tertiary care hospital. Lee Memorial says it sees a relatively low amount of pediatric trauma cases each year, and most can be cared for right here in Southwest Florida. Doctors work closely with hospitals in Miami, Tampa, and St. Petersburg, and right now Lee Memorial says things are working, and quote, at this time there is not a need to create a designated pediatric trauma center. Sarah Belsol, Fox 4 in your corner.
Now, Lee Memorial also announcing earlier this year a clinical affiliation with Miami Children's Hospital and have established a telemedicine program.